The following is a CTV News Calgary special presentation.
He laid there for a very long time. It's hard to watch somebody you love slowly die.
You call them in a medical emergency.
When you placed the 911 call, what were your expectations?
But will an ambulance arrive when you need it?
The public is starting to realize that it's at a breaking point.
Kathy Lee investigates. Broken system. EMS crisis in Alberta.
In a time of crisis, most of us assume a call to 911 will lead to an ambulance arriving quickly. This is the case for many emergencies in Alberta, but when it's not, the consequences can be devastating. Dawn and Andy Anderson were soulmates. They were inseparable.
Amazing man. Love of my life.
But everything changed early in the morning on January 18th, 2022. Dawn woke up, but was then in and out of consciousness.
He just felt dizzy and then he fell back.
Panicked, Andy dialed 911.
Ambulance dispatch for what town or city?
Calgary, please hurry.
Tell me exactly what happened.
He's seizing or unconscious. He had major surgery. He has heavy-duty staph infection.
So I'm sending the paramedics to help you now. Stay on the line and I'll tell you exactly what to do next.
Okay,
Reassure him the help's on the way.
He had hemorrhage through his bowels, so most of his blood was on my floor at home. He laid there for a very long time, and you know, it's hard to watch somebody you love slowly die, and there's not a thing you can do to help them.
So we don't have an ambulance dispatch at the moment, but as soon as we have one available resource, we'll be sending them right away.
Well, like, how long is this going to be? Like, holy
I don't have an ETA at the moment.
When you placed the 911 call, what were your expectations?
To have an ambulance. It should not take 3 calls to get an ambulance. That's horrific.
The ambulance arrived at South Health Campus at 7:20 a.m. By 10 a.m., 57-year-old Dawn Anderson died 2 weeks before their 13th anniversary.
When he died, I died. Like, my life has been turned upside down.
In Alberta, 911 calls for medical emergencies are triaged and coded into levels of increasing urgency. Alpha calls are considered minor. Then there are Bravo, Charlie, Delta, and Echo calls, which warrant lights and sirens. Freedom of Information records show the operator had coded the first 911 call as Alpha. 50 minutes later, it was upgraded to Delta, and an ambulance was dispatched. Don Sharp is a retired paramedic of more than 40 years. He worked as a dispatcher in the early days of his career and also trained new recruits.
The initial call taker sounded like he was asking all the right questions, getting the right information, but then I see that it was sent not lights and siren, as a cold response. And based on what I heard, that call should have at least gone lights and siren.
Do you believe in your heart that if an ambulance had arrived within a reasonable amount of time, that he could have been saved?
I don't know. I really don't know. All I know is he wasn't given the choice.
Andy also wonders why she was told an ambulance was dispatched when it wasn't.
And that is one I cannot forgive. If you're not going to send an ambulance, don't say one's on the way.
An emergency communications officer, or ECO, in dispatch agreed to an interview. We're protecting their identity as they fear discipline for speaking to us.
We're not allowed to tell the public that an ambulance has not been assigned to their call. That's the hard part, is when you're literally lying to somebody and telling them, like, we've got somebody on the way, our closest available unit is en route, and they're like at the bottom of the queue.
Alberta Health Services said an ECO follows a stringent set of guidelines and that estimations about ambulance response times or status are not provided unless requested by the caller. This ECO says ambulances not assigned to a call is the norm these days because the province is in a constant state of red alert when no ambulances are available to respond to a call. Records CTV News obtained show some of the longest dispatch responses in Calgary this year ranged from 1 hour and 21 minutes to 7.5 hours for Delta and Echo calls. But there were also long dispatch responses of more than 6 hours for emergencies prior to 2018.
But you'll have around 20 calls just sitting and pending, and sometimes they've been waiting for hours.
More calls than pending plus long dispatch times means longer response times. Some of the longest response times to Calgary this year for all types of calls ranged from an hour and a half to almost 11.5 hours. But there were also long response times ranging from 4 to close to 7 hours prior to 2020. Response times in Calgary that are more than 30 minutes long are still rare, but in the last 8 years, it's grown to 18% from less than 1%.
So this is her garden?
Yeah, this is her domain. This is her love.
A long ambulance response time might have sealed the fate for Candace Speck's aunt, Betty Ann Williams, called Rusty by friends and family. The 86-year-old loved her garden and was eager to spend more time outside, especially after recovering from cancer.
Yeah, you know, she was a fun, just all-in-it girl. You know, she just loved life.
On June 5th, 2022, Rusty was in her back alley pruning weeds when she was mauled by her next-door neighbor's 3 pit bulls. Nicola Opsel, another neighbor, made the 911 call at 2:01 p.m. She says a bylaw officer arrived shortly, as did an ambulance, but it wasn't for Rusty, and drove by.
What the hell is going on as time is going by and no one else is showing up? I'm getting more and more upset.
AHS says the city was in red alert and that it took paramedics 30 minutes to get to Rusty. She died on the way to hospital.
I couldn't touch her. They wouldn't let me kiss her. The damage was so extensive that they didn't want more trauma to me. But basically, she was just shredded from head to toe.
AHS says the call was coded as non-life-threatening, and it wasn't until a second call was placed to EMS about the seriousness of the injuries that an ambulance was dispatched. Records show the ambulance responded in 9 minutes and 53 seconds, but it wasn't dispatched for at least 20 minutes. From the time Opsel made the 911 call to when the paramedics showed up, nearly 40 minutes had passed. She feels AHS blamed her for not relaying correct information about the emergency.
You know, had they showed up sooner, you know, would she have lived? I mean, we don't know, but I worry, you know, did I say enough? Was I, you know, urgent enough on the phone?
How would you describe the system, the EMS system?
It's terribly run. You know, it's sad that they don't have enough ambulances or people to run them or anything, and it's like, how did we get here? I'm just heartbroken, and I don't know if I'm ever going to recover from this.
And recovery for Andy is a long road, but the memories of Dawn gives her strength.
He was into Harleys. We would go riding. We were supposed to do a big trip this summer. I went riding with a friend 2 weeks ago on his bike. As much as I loved it, it was bittersweet. All I can think of is I'm supposed to be doing this with my husband.
Until that day comes, telling her husband's story is her way of honoring him.
I have no faith in 911 anymore, and that's a shame. People need to know that it's bad, and it's really bad. And it's not just my story. There's many, many more stories.
The EMS system in Alberta is connected, which means when big cities like Calgary or Edmonton go into red alert, surrounding communities are impacted too, and can often be left without an ambulance to help their own citizens. Not having an ambulance is what Leah Lucier and her son Braden experienced back in January. Her 10-year-old has an extremely rare genetic disorder and is considered high risk for medical complications. When he fell on the ice outside their home and broke his femur, it was serious.
With a broken bone in that area, all it takes is a nick to your artery. So I didn't know, was he bleeding internally?
They called 911, but on this day, 45 minutes passed and still no ambulance. So Lucier called back and begged for the fire department to come and take Braden to Airdrie Urgent Care.
I knew the system was bad, but to live it was severely traumatic.
So why doesn't an Airdrie ambulance stay in Airdrie? It's because of the borderless system in Alberta implemented when the province took over EMS in 2009. That means ambulances from anywhere in Alberta can also respond to emergencies outside their communities if they're closest. But being close doesn't necessarily mean help is actually close at all. Sometimes it's more than an hour away. Those same ambulances can also be relocated or flexed to serve other communities if they are needed.
Well, that borderless system was told to the rural communities that was going to be a great advantage, because when your truck left, another truck would move into cover. Well, that was great in theory.
In reality, AHS data shows that since 2014, an increasing number of ambulances from small communities are responding to emergencies or being flexed outside their jurisdictions, especially to Calgary. But the same level of response or flexes from Calgary ambulances to smaller communities hasn't been reciprocated. Brian Winter started EMS services in Cochrane in 1983. He says the lack of ambulances in his community is felt even more when their fleet gets pulled into big cities during red alerts.
For a Delta call, they could be waiting up to 20-25 minutes for someone that needs EMS treatment right away.
AHS data shows some of the longest response times for the most severe emergencies in Cochrane even reached more than 52 minutes this year. And the same is happening in Airdrie. Some of the longest response times were close to an hour for Delta and Echo calls, leaving some families with little choice.
A fire truck had to transport your son to the hospital.
It's not something that they do. It's not part of their jobs. They had to break protocol to do that.
And the Airdrie Fire Department isn't the only one that had to break protocol. In the early hours of June 26 this year, the Calgary Fire Department transported 3-year-old Tara Agarwal to hospital after she fell on her head and started seizures. She and her parents were visiting from Toronto and were able to reunite with the firefighters who helped save her life. This year, the Calgary Fire Department transported 4 patients to the hospital. Calgary police don't track that information, but officers are doing it more and more, including a call to a bar in Kensington this summer for 29-year-old Brandon Sklenka.
I just woke up to an alarming text message that he wasn't in the right mental state. So I was at home and I called 911 right away.
But an ambulance didn't show up right away. Records show a paramedic response unit, or PRU, did 14 minutes and 44 seconds later. It's staffed by a paramedic but can't transport patients.
Remember them saying that they didn't have a stretcher. That's just scaring me more because I'm like, oh, why isn't there a stretcher? Why isn't there an ambulance?
25 minutes passed and still no ambulance. That's when Calgary police made the call to take Brandon to hospital. But it was too late. Tragically, Sierra Payne's partner of 8 years died.
It honestly just didn't seem real. I kept waiting to wake up from a nightmare. It's not that the staff aren't trying their best. I know the first responders with Brandon did everything they could.
Traumatic incidents like Brandon's aren't easy for police either. An officer on scene has to make the difficult decision to take a patient to hospital. And because this is happening so often, police and firefighters are now able to call a physician who can give them direction. Deputy Chief Chad Toffick says Calgary is the first police force in the province to implement the physician call line protocol.
Do you have enough resources to be able to take someone to the hospital?
We've got a lot of work in front of us as well. Our staffing challenges are not unlike other emergency services, and I think you see that across Canada. Ideally, in the long term, I think we'd want to see EMS and AHS have the capacity they need to respond in a timely manner to all these situations. But in the absence of that, we got to do our part.
It seems like they're accepting that this is okay, that CPS is going to be transporting people as often as they do, rather than fixing like the stem issue of that shouldn't be happening regardless. So it just seems like acceptance of a problem rather than fixing the problem.
Paramedics in Alberta warned about the declining state of EMS well before COVID-19. While the pandemic added more strain, those working the front lines say the crumbling started years before.
I'm Mackenzie Payne. I'm a paramedic working in Alberta, and Sierra is my sister.
Mackenzie Payne agreed to an interview, but is sharing his personal opinion and doesn't speak on behalf of Alberta Health Services.
Do you feel like your job is at risk by talking to us?
Yes, I am a little bit.
But after what happened to Sierra's late partner, Brandon Sklenka, who was transported to hospital by CPS when EMS didn't show up, Payne couldn't keep quiet.
My worst fear in all of this has always been that an ambulance wouldn't be there for my family, and then it happened.
Payne says morale is the lowest it's been in his 15 years. Paramedics are overworked, tired, and stressed.
Some people do a 24-hour shift, even up to a 96-hour shift, so you need time to turn off sometimes, right? Especially some of these calls are high stress.
A Freedom of Information request shows since 2015, overtime and sick time hours for Alberta paramedics have almost or more than doubled. Mike Parker, president of the union that represents paramedics, says on average there are 600 unfilled paramedic shifts per week across the province.
We stopped taking care of the paramedics on the street. We expected them to be a disposable product that we could just replace at any time.
The strain is also felt in this room. This emergency communications officer says after dispatch consolidation for remaining municipalities in Alberta, including Calgary in 2021, the transition was chaotic. There wasn't enough staff and they weren't trained properly. Now the strain is even worse because many are burnt out.
There was a note that we have that describes an evening in this province, and it was a weekday evening, and there were 4 people answering 911 calls in the province of Alberta for our paramedics. 4.
And this means potentially more mistakes.
If it's not coded properly, then it comes out as a lower acuity call. This person may actually be in a lot more medical distress or whatever, and they don't get the resources because we don't have anybody to send.
Alberta Health Services has blamed the strain and lack of new recruits in the last few years on everything, including the pandemic, weather, wildfire smoke, opioid crisis, to low birth rates.
There's always seemed to be some excuse, but it's been going on for a long time. The public is starting to realize that it's starting to break, it's at a breaking point.
So our resources need to match the growth of our population and call volume increase, and they haven't.
And when there are no resources, red alerts happen. The numbers in Calgary have been growing over the years, even before the pandemic hit. The number of red alerts in Calgary almost tripled between 2017 and 2018. And this year, the average number of red alerts per day is 15, compared that to 6 red alerts per day the year before. But AHS has consistently said red alerts don't last very long.
And then they say, oh, no, red alert's off, because we have 1 ambulance available in the Calgary zone. That ambulance could be in Strathmore. That's the 1 ambulance that's available, but they canceled the red alert because, okay, now we have an ambulance available. It's dishonest.
So how did we get here? Was EMS in Alberta always like this? Not according to these 2 men who were employed when EMS was run by the city of Calgary.
We were enthusiastic about going to work. We were proud of what we did. We had great leadership.
We were probably the top 10 EMS in North America.
Dwayne Clayton was in the room when the province announced it was taking over.
The idea that you could hear a pin drop in the room was exactly it. The only sound maybe was people's jaws dropping and hitting the table. Because In all the scenarios that had been thought of for us, that was the worst.
AHS says the reason for a centralized system came because municipalities wanted government funding for EMS, and it was a way to standardize patient care across Alberta. Paramedics were told there would be no degradation of services.
By 2012, it became obvious to me that there were lots of problems with this new system. Hallway waits were getting worse. Response times were lengthening.
Don Sharp says hallway waits are the main reason people who call 911 are not getting emergency care when they need it the most. It happens because paramedics are required to stay in the hospital with the patient because there are no emergency beds to put them in. Paramedics started doing this before the province took over EMS, but it's gotten worse. Many are now waiting in hospitals their entire shift and can't respond to calls. In the case of Don Anderson, although the ambulance arrived at the hospital around 7:20 a.m., the paramedics weren't cleared until 2 hours later.
Even after my husband got to the hospital, they left him there in the bay. Why is he sitting in the bay?
The reason for hallway waits is access block, when patients are unable to move from the emergency department to a bed in the hospital. Dr. Peter Jamieson says this has been an issue for years.
It's not the patient's fault. It's because they have a particular set of needs which could be met in other places. We just have to get the services in the community organized or funded for them.
But he says efforts are underway to address the problem.
I think we're kind of at a really low point in EMS right now, but like, did you ever think about that? What this is going to look like in 5 years?
I do, but if you would have asked me 5 years ago if it would be here right now, I would have never predicted it. So I honestly have no idea. I hope it gets better because I still have a long career left that I want it to be better.
Think of them as guardian angels, but for EMS, not crime prevention. The Cochrane EMS Crisis Citizen Action Group is exploring the idea of training civilians in CPR and first aid who can be called in the event of a 911 response delay.
It means that we could get somebody on the spot right away, and they would arrive at that house. There's somebody who can be calm and non-emotional. They can assess that situation.
The town is taking matters into its own hands, even as the province responds to the EMS crisis by adding $64 million to the budget.
We're adding more money, but we need to transform how we manage the system to be able to address this.
And in January, AHS unveiled a 10-point plan to address the ongoing pressures. That includes measures like hiring more paramedics, buying more ambulances, and managing non-emergency transfers between hospitals. But Brian Winter says the plan doesn't address hospital hallway waits or flexing rural ambulances, which he says needs to stop immediately. As for non-emergency transfers,
we have a private service in Cochrane. They have told us that they would take the transfers into Calgary.
Alberta's chief paramedic Darren Sandbeck says the province has seen a 30% increase in call volume since last spring, a stark difference from the 4 to 6% annual increase normally experienced.
We planned for that. Where we could, as budget allowed, added resources to the system. But frankly, we were probably behind in adding resources.
Paramedics say some of the ambulances in the current fleet are broken down and others on the street are well overdue to be retired. Sandbeck says they're having a tough time buying more. 134 have been ordered, but they've received less than 30.
That requires us to manage our existing fleet. We're hiring at a rate that we have never hired before. Over 200 staff.
Nobody's joining the system. We have postings all across this province we can't fill. They've saved a hell of a lot over the last 15 years by not hiring any, so it's going to take a lot. And they will say that we hired a few, but they will never compare that to how many they've lost that week or how many have exited the system.
The NDP has been critical of the state of EMS, saying the focus should be dealing with the opioid crisis, getting paramedics off shift on time, and offering new recruits full-time positions.
That 10-point plan came out at the same time as the government was demanding wage rollbacks from paramedics. More plans to make plans, more committees do not help the frontline workers who are struggling right now.
As for the other cities across the country, they're also dealing with their own EMS issues. But comparing red alerts and hospital hallway waits to Ottawa, a city with a similar population to Calgary, we found in 2022, Ottawa paramedics spent 174 hours a day waiting in hospitals, while Calgary paramedics spent 334 hours a day waiting in 4 of the city's main hospitals. And for red alerts, Ottawa averaged 5 a day, while Calgary averaged 15 a day. On the issue of morale, Chief Sandbeck acknowledged it's a concern.
We need to do a better job of being out and talking to our folks, being out and engaging our folks.
I don't think your medics are out there trying to stir things up. You know, I found it difficult to find any of them to speak on the record because they're scared of reprimand and discipline.
I understand that, but I don't think that we've ever disciplined or reprimanded anyone for speaking up.
But a Freedom of Information request revealed Chief Sandbeck is aware of a case where AHS suspended Airdrie paramedic Ryan Middleton without pay for social media posts about EMS on his personal account where he doesn't claim to be representing his employer. AHS says it can't comment on the matter and doesn't regulate, restrict, or direct private or personal views or opinions of individuals. Middleton declined an interview as he awaits arbitration. However, those familiar with his situation are outraged.
What kind of system is it where you are muffled? What kind of system is that you are punished or you have to disappear if you speak out about the truth of a work situation?
The work environment is so toxic that I don't think anybody in the current leadership doesn't matter what they do, they'll never fix it.
Can the system be fixed, and how long will it take?
The things that we put in place may work some, it may not work at all, right? But we're going to learn from it and then keep going because we're going to have to keep moving to fix it.
It's too late for Andy, Candace, and Sierra, but they too still want to see changes.
Are you optimistic, at least, that there will be meaningful change?
Not right now, I don't. They can say all they want, right? But like, the proof's in the pudding. I need to see it.
It's easy to make empty promises or turn it into a political thing where it's, oh no, it's because this party is in power, or this party is in power. It's like, okay, what are you actually doing to improve things then, other than saying what you're going to do and not getting them done?
If you had an opportunity to sit down with people who could fix this, would you?
Oh, in a heartbeat. In a heartbeat. They need to see the people they're affecting. It's, you know, you need to see the people's lives you affected, because we're people, and you're costing people families and loved ones, and you need to realize what's going on here.